DIV ozone injections. What is the single most important safety precaution that should be done during DIV and after DIV ozone treatments? I'm Paula, the crazy ozone lady, and here I will tell and I will explain why this one thing should be absolutely part of the DIV ozone procedure. And so this will be something that will be contrary to how DIV ozone treatments are practiced and are administered in the US and also in many other parts of the world. So be prepared to be incredulous or to have a strong opinion against what I will be saying, or just maybe be even shocked. But as usual, there is a method to the madness, and I will present what I think is pretty convincing material and pretty convincing information why what I'm saying should be really taken into consideration, and why everyone actually who performs DIV ozone injections on themselves or on their patients should follow this safety precaution, because this one single thing can really prevent the most serious complications, so things like loss of consciousness, loss of vision, and even death. So anyone who has watched my other live stream about the risks and possible complications after DIV ozone injections, so may be also interested in what I have to say here. But first of all, some shameless self-promotion. So if you're interested to be consulted by me, and I can show you how to use ozone therapy in the most effective way, because nowadays ozone therapy is not applied effectively in many cases, then go to thepowerofozone.com/book me, and there will be also a link underneath the video where you can just click on that link and book me. Another thing, if you're interested to learn more about DIV ozone injections, there is something coming up, something that I've been working on the past few weeks, and I hope it will be ready in the coming maybe 2, 3, maximum 4 weeks. So if you want to be notified when this thing will be ready, then also subscribe to my newsletter. That is thepowerofozone.com/news. And I don't want to say anything more, so I will keep the suspense up. But yeah, definitely, if you want to be notified, if you're interested in DIV ozone injections, then this is something to look out for. So yeah, thepowerofozone.com/news. All right, so let's get right to it. So what is the most important safety precaution when doing DIV ozone injections? And as I said, many of you who had DIV ozone injections done, who went to a doctor either in the US or somewhere else, and of course the most famous DIV ozone doctor is Dr. Robbins in New York City, and he, from what I understand, he does not respect the safety precaution, and yet here I am saying, no, this is not the right way that it is being done right now. The right way is to remain horizontal for at least 30 minutes after the injection. So this is the single most important safety precaution with DIV ozone injections. So yes, there are YouTube videos of people performing DIV ozone injections, and they are standing upright. They're even giving entire presentations. Another video, it shows a person actually even going around and like walking from one room to the other with the needle stuck in his arm and performing the injection, and nothing happens. And yet here I am telling you, no, this is absolutely wrong. You should not be running around. You should be instead remain horizontal and immobile for at least 30 minutes after the injection. And so I will explain why that is. And but if you're wondering why this discrepancy, why So many times DIV ozone injections are performed in a way where people are told that after 5 or 10 minutes they can get up and everything is fine. And here I say no. The most important thing is to remain horizontal and immobile for 30 minutes. That shows how safe DIV ozone injections are. That even if you do not respect this most important safety precaution, that the risks and complications are still very, very rare. But this is the good news. But the bad news is that when complications appear, then they are very serious, because we're talking about things like loss of consciousness, loss of vision, loss of memory, cognitive impairment, other neurological deficits, and even death. So, yes, complications are extremely rare, even if you do not respect that precaution, but when complications happen, they can be really serious. So, and with this one thing, just to remain horizontal and immobile for at least 30 minutes after the DIV injection has been done, has been finished, you can put the risks of complications to an absolute minimum. So you're making the DIV ozone injections even safer, okay? And so when I mean horizontal and immobile, I mean no talking, no lively conversations, no laughing, no moving with your limbs. I mean remain really relaxed and stretched out for 30 minutes. Okay, so now let's get to it, why I think this and what the evidence is that this is really one of the most important things to do. Well, but first of all, hold on a second. Let me change here something because I see that this is in the way. All right, so now let's go to the presentation, to the evidence. So, anyone who has watched my other video about the risks and complication of DIV ozone injections, you probably remember what I told about Dr. Hans Wolf. And this is a picture of Dr. Hans Wolf performing what turned out to be a deadly DIV ozone method. So here he is injecting pure ozone oxygen gas into a patient's varicose vein. And as you can see, he's doing something that turned out to be a huge mistake. And Dr. Hans Wolf, he did two big mistakes. So the first mistake that he did is that you see he is injecting gas here with the tourniquet being applied on the patient's limb. So you should never do this. Now he devised this method thinking that this would actually prevent accidents, but it had exactly the opposite effect. And so this method turned out to be very, very dangerous. So that was number one. Number two is that after injecting the gas, the people would remain with the tourniquet applied to their limbs for 20 minutes. Then he would release the tourniquet and he would tell them to get up immediately. So he would not tell them to rest. And this was the second big mistake that he would do. And this is what led to a cluster of very serious incidences in the 1970s and 1980s in Germany. And that is because Dr. Hans Wolf devised this method with those two huge mistakes, and other doctors were also applying that same mistaken method. So, but there is more to the story, because Dr. Hans Wolf actually was not the first doctor who was using DIV ozone injections to treat varicose veins. That doctor was Dr. Franklin Bircher, and he was a Swiss doctor, and he was practicing in the 1940s, 1980s, I think even before that. And he was also using DIV ozone injections. And he was also using that dangerous method of applying tourniquet and injecting the gas with that tourniquet applied to a patient's limb. So this is the mistake, this is the wrong method here. I stressed it in this presentation because I really don't want anyone to try to reproduce this. But what he did, he allowed his patients to rest for hours afterwards. Okay, and this was one major difference that he did to Dr. Hans Wolf. And so just by doing this, just by allowing patients to rest for hours afterwards, after he removed the tourniquet, after the DIV injections, he did not see any deaths, any complications, nothing. So actually what he did, his method, it is described more in detail in Dr. Hans Wolf's book, the Medical Ozone, is that Dr. Franklin Börcher, what he did, he was injecting patients late at night who were already in bed, lying in bed and being ready to basically fall asleep. And this is when he would apply the tourniquet, inject the ozone, and then after 20 minutes he would release the tourniquet, but the patients would not get up. So they would remain in bed and they would just fall asleep. And they would get up after 6, 7, or 8 hours, or however long people sleep. And then in the morning they would get up and everything would be perfectly fine. So this shows that you can still do this one mistake with a tourniquet, but as long as you allow patients to rest afterwards, nothing will happen. And consequently, nothing did happen. There were no complications, no deaths. But then Dr. Hans Wolf came along and with his modified method, and he also was injecting ozone intravenously, and he was applying the tourniquets. And remember that picture that I just showed you with a tourniquet applied to that person's leg. But what he did, that after he removed the tourniquet, he would tell patients to get up. So they were not told to rest. And this is what caused those complications, because what this must have caused is basically that you had a huge chunk of gas in the vein being trapped because of the tourniquet. Then he would release the tourniquet, and that big chunk of gas was then transported through the bloodstream. And we know that up to 30% of the general population, that they have a ventricular septum defect. That means basically that there is a type of a hole in the heart. And this type of a hole allows for some of the venous blood to enter the arterial blood. So if you have that chunk of gas being catapulted through your bloodstream, and if at the same time the patient has this ventricular septum defect, then this gas could have entered the arterial bloodstream and then gotten into the brain. And when you have gas bubbles, a huge parts of a gas bolus entering your brain, then this will of course cause a gas embolism in your brain. And then you have things like loss of consciousness, you have memory problems, people are confused, dizziness can appear, various other neurological deficits set in, up to even death. And so this shows that really how important it is to allow people to rest. And Dr. Hans Wolf was not doing this, and consequently he was causing really, really serious complications. And here I say it was 3 to 5 deaths. That is because 3 deaths were contributed to DIV ozone injections in the 1970s, 1980s in Germany, but possibly 2 more deaths, but it's not entirely clear because the way they have been attributed to ozone treatment, it's not clear whether it was because of the DIV injections or because of an allergic reaction. So here it is really important to see those 2 doctors who really differed in just this one point, that one doctor, he allowed his patients to rest for hours afterwards. He saw no complications. The other doctor, he was telling his patients to get up immediately after the tourniquet was removed, and consequently he saw all those complications. And now another interesting piece of the puzzle here is the art of Oxyvenierung. So Oxyvenierung, this is the injection of pure oxygen intravenously, and this has been started by Dr. Regelsberger and now is being further performed by Dr. Virchow, although I think I may have misspelled his name. I think it's Virchow. Anyway, this type of intravenous oxygen injections has been going on in Germany for since the 1960s, for the past 60 years. So this is very, very similar to DIV ozone injections in that pure oxygen is introduced intravenously. And so the reason why it makes sense to compare those two methods is, of course, because when you inject DIV, so let's say if you have a syringe full of ozone ready to be injected for a DIV ozone injection, and let's say so you have 50 or 60 cc of ozone gas at a concentration of, for example, 30 micrograms per milliliter, then that means that only a tiny fraction of what you have in that syringe, so there's only 2 to 3% are actual ozone, and the remaining 98 to 97% is pure oxygen. And ozone, of course, is just a different type of oxygen. So you can also say this is activated oxygen. So essentially you have 100% pure oxygen in that syringe, only that a tiny amount of it is activated oxygen. So this is essentially more or less the same thing that happens during Oxyvenierung, or the injection of pure oxygen intravenously, which is performed by the thousands up to this day in Germany every year. Okay, so how do they do this when they perform Oxyvenierung? How is this performed? Do they use a tourniquet? No, they don't use a tourniquet. The injection of pure oxygen during Oxyvenierung is not performed during an applied tourniquet. So there is no tourniquet on a patient's limb when one injects pure oxygen. And also the patients are instructed to remain horizontal and immobile for 30 minutes afterwards. How do I do that? How do I know this? Is because I have actually attended this seminar of Oxyvenierung. So I'm actually a licensed Oxyvenierer. So I have that there was a test at the end of the seminar. So this is what we were taught. We were taught to instruct the patients to remain horizontal and immobile for 30 minutes after the injection. And this is how those pure intravenous oxygen injections are performed to this day in Germany by the thousands. And what is the result? The result is that in those 60 years, there were no deaths, no complications. Okay, well, there was one complications that they reported, that one patient lost consciousness, but it was only briefly. He regained consciousness shortly afterwards, and there were no residual problems. The patient recovered 100%, so it was only a temporary complication. But there were no deaths in 60 years of performing intravenous oxygen injections in Germany. Not a single known death has been reported. And the reason for this is because they are telling people to remain horizontal and immobile for 30 minutes. So I will keep repeating this because this is really, really so important. And now some of you may say, okay, hold on a second, but I have actually received DIV ozone injections from Dr. Robbins or from some other doctor in the US, or someone who has been maybe trained by Dr. Robbins, and I was not told to remain immobile for 30 minutes, and I got up after 5 or 10 minutes and I was fine. And yes, so this again, this stresses, this shows, this proves how safe this is, how safe DIV ozone injections are. Because, okay, so let's go through this. So how are DIV ozone injections currently applied, administered in the US? So there's no tourniquet used like Dr. Hans Wolf or Dr. Bircher used, luckily, and this is the right way to do it. But patients are not told to rest, right? So they can get up after 5 or 10 minutes. And what is the result of this? So the result of this is still pretty safe, but I know of 2 cases. Now I put some question marks behind it and I'll explain why. But there are 2 cases where people reported that they lost consciousness after this type of ozone injection that is being performed in the US right now. So one case is a person who has contacted me personally and who has also commented in the Facebook group Ozone, the Ozone group, and you can join that group and you can read for yourself. So this person said that yes, I believe it is she received DIV ozone injections and she actually passed out afterwards. But then, from what I understand, she regained the consciousness quickly afterwards and no residual problems remained, from what I understand. Then another case was relayed to me by a doctor. So this is, this, you can take this as rumor or as just as a rumor, because this is nothing that has been documented officially. No report has been filed as far as I know. So I don't know exactly what happened and if it happened. Of course, I wasn't present when this happened, but it is possible, even likely, I would say, that this can happen because, as I said, if patients are not told to rest afterwards, this can happen. So loss of consciousness can happen. It is very possible that there are even more cases than this, but they simply have not been documented, or doctors simply don't talk about them. So this is absolutely possible. There were also some temporary cases of temporary loss of vision. So this is something that I have also experienced. Well, this was one patient, one case where the person was already suffering. So the person had a history of ocular migraines. So ocular migraines, this is what happens during ocular migraines is that people lose their vision or just partial loss of vision. So that person experiences after DIV injection, but also had experiences already before without any ozone treatments. But she was convinced that one time it was triggered by DIV, and it's absolutely possible. So this shows that really how safe DIV ozone injections are. Because so my conservative estimate is that in the past 20 to 30 years, around 400,000 DIVs must have been performed, probably more. So this is a really conservative estimate. So in 20 to 30 years, so we only have 2-3 different cases of loss of consciousness, temporary loss of vision. So I really challenge anyone to find me anything comparable in conventional medicine, any drug, any over-the-counter medication, any therapy, any other intervention that is currently practiced by medical doctors which can match this safety record. So this shows really how safe DIV ozone injections are, and that when complications occur, they're very, very rare. And luckily, no one uses the method of that crazy German doctor, Dr. Hans Wolf. So of course, none of the serious cases that he experienced are seen as often as that was the case in the 1970s and 80s. So we see that really DIV ozone injections, even if that one thing is not respected, even if patients are not told to remain horizontal for 30 minutes afterwards, it's still extremely safe. But again, to stress that if a complication happens during DIV ozone injections, it can be very serious, because loss of consciousness, this is very, very serious. Neurological deficits, neurological impairments, very serious, and the loss of vision, of course. So all those things, they lead to the assumption that they happen because of gas embolisms in the central nervous system. But the most important, the safest methods to prevent even those super rare cases of complications is to remain horizontal and immobile for a solid 30 minutes afterwards. So I hope that this is helpful for anyone who is thinking about injecting himself or herself with DIV ozone injections, and of course for any doctor or any practitioner who is thinking about performing this method. And I understand that this is, when it comes to logistics, it's a little more complicated to tell someone, you need to remain here for 30 minutes, and that patient is basically taking up space, taking up the chair where a new patient could come in and could be treated. So it is makes the logistics, let's say, in a practice a little more challenging. But if you really want to reduce the risk of serious complications to near zero, then this is one of the most important things. So just with this simple one thing, just by remaining horizontal and immobile, not having any lively conversations, not laughing, just be relaxed and stretched out for 30 minutes. So this can really reduce all the risk of serious complications to an absolute minimum. So I hope this was helpful. Keep in mind, this is not medical advice. Do not take medical advice from a crazy woman, from a self-proclaimed crazy woman. And that was it for today. Thank you very much. Thank you very much for listening. Thank you very much for tuning in, and see you in the next one. And remember to subscribe if you want to have notification about what's coming out in the world of DIV ozone injections. Bye bye.